Today we're with Mandy Illston to talk about the dental health of a thoroughbred. Foals, we'd go back right from the start and talk about young horses and the development of their teeth right the way through. How would you describe that development?
When they're born as foals, they have 3 little molars, and then they develop their first incisors within a few days, and then over the next period of time, 6 months, they start to erupt more incisors. So having the opportunity to check foals' mouths and check for any abnormalities or conformational defects is what you're looking for in the early stages. Once they get past a year old, then we're starting to look for different pathology and normal pathologies that will develop through their teeth growing and creating these sharp points and things. So early stages we're looking for conformational abnormalities as much as anything of their mouth. With the younger horses, we're ensuring that their caps are coming off in the correct order, making sure that that's all happening correctly, and their new teeth are erupting underneath in the correct fashion.
What are some of the signs that the horses will show us if they're having issues with their teeth?
Some of them will have difficulty in eating. Certainly as horses have developed really large hooks, that really interrupts with their eating, and often you'll find old broodmares will have huge big hooks, and that they'll be getting skinnier in the paddock and really struggling to eat hay especially. And then with young horses or any horse in work, they do have a different tolerance level. When you get the really good guys, you can open their mouths and they have horrific ulcers and they're trucking around fine and behaving well, but a really sensitive horse, the ulcers will really affect them in one of 2 ways. It seems that they either try and desensitise it by really hanging onto the bit and pulling like a train or leaning or lugging, or they do the reverse where they get sensitive about it and start flicking their heads around and not wanting to take the contact at all. So they're both, if they're being difficult to ride, it's a fair indication that at least look at their teeth, and we'll rule that out and hopefully find some pathology that can be fixed to make them a better horse to ride.
If we're talking about getting our horses' teeth looked at by a dentist, what are the important stages or times in their lives that they need to be seen?
The gold standard certainly is that we look at them as foals. It's not often you get that opportunity, but it'd be fantastic if we did. And then checking them every 6 months from then on through to 7 or 8 years of age. By that stage, all of their teeth have erupted, things have settled down. So if they've got really healthy teeth, you can stretch it out to once a year after that.
If we talk about the development of the equipment from years ago that we used in dentistry to what there is today,
yes,
what are the changes that we've seen?
Huge, absolutely huge. I know when I started as a vet, I had 2 terrible little gags and I knew I was doing a bad job. We just took off some sharp points and didn't do a lot to their mouths. But nowadays we've really gone into the power tools and really added an enormous amount of equipment to what we carry around. We've got the mirrors and picks, we can go and check all aspects of the horse's mouth. We're much bigger on flushing their mouths out. We get in there with lights and actually have a proper look inside the mouth rather than just feeling. So it's really come ahead in leaps and bounds in the last few years.
If we talk about the horse's health as a whole, where would you place the importance on the dental health of a horse?
I always think the dentistry is it's just one thing that's can make their lives so quickly so much more pleasant. So just keeping a check on them at least annually has to make life better for the horse. And once you have done that check, you know where you're at. So people talk about the cost of dentistry, but it's a one-off fee for the year, or twice yearly, end of story. It is of quite high importance, I think, and a simple thing to do.